Hello, this is Carla from the PERS Health Insurance Program. Thank you for joining us today. We are going to discuss your healthy retirement options in connection with the PERS Health Insurance Retirement Program offered to you as a PERS retiree. Determining your financial needs. According to the Fidelity Retiree Healthcare Cost Estimate, a single person age 65 in 2023 may need approximately $157,500 saved after taxes to cover healthcare cost expenses in retirement. The average retired couple, age 65 in 2023, may need approximately $315,000 saved. We recommend creating a retirement budget for healthcare. Take advantage of all health savings accounts that are available to you and consider long-term healthcare insurance. Determining your healthcare needs, develop healthy habits. Lifestyle changes, family status is something to consider. It is said that an ounce of prevention is worth a pound of cure. Proactive planning. By failing to prepare, you are preparing to fail, according to Benjamin Franklin. The PERS Health Insurance Program is one of many options for health insurance in retirement. Health insurance benefits are specific to each and every individual, and we recommend everyone review all options open to you. You may have retiree employer-sponsored group coverage available to you through your PEB and/or OWEB plan. Your spouse may continue to work and have employer-sponsored coverage after you retire, and you as a retiree may be eligible to remain on your spouse's active plan. There are also individual plans available on the marketplace, and you may have the option to invest and enroll in a COBRA plan through your employer coverage when you retire. The PERS Health Insurance Program difference is this. We are a voluntary group health plan customized specifically for PERS retirees. We offer non-Medicare, Medicare, and dental plans. All of our plans have enhanced benefits such as vision and hearing. For Tier 1 and Tier 2 retirees, there are premium subsidies that may be available to you as established by the Oregon legislation. We also offer the ability to change your plans annually under the PERS Health Insurance umbrella. Who's eligible for the PERS Health Insurance Program? A PERS retiree who is receiving a retirement allowance or benefit, or a PERS retiree who has received an optional lump sum payment, the spouse of an eligible PERS retiree. We also cover your dependent children who are under 26 years of age, as long as they are a natural child, a legally adopted child placed in your home pending adoption, a stepchild who is living with the eligible PERS retiree, and/or a grandchild as long as the grandchild's parent lives with the PERS retiree and that parent was covered under the retired member's PERS health insurance plan at the time of the grandchild's birth. We will also cover overage dependents, 26 or older, should they be unable to achieve self-support through work due to a developmental disability as verified by their physician. We will cover an eligible surviving spouse or dependent of an eligible PERS retiree should that PERS retiree pass away. We also cover dependent domestic partners, providing they meet the below listed criteria. You had a relationship and lived with the PERS retiree for a minimum of 12 months. The PERS retiree is providing more than 50% of the partner's financial support and must have claimed their partner as a dependent on their most recent federal tax return. PERS Health Insurance also requires a copy of a dependent domestic partnership affidavit. What are our PERS Health Insurance enrollment opportunities as applies to Medicare and non-Medicare plans? So if you are a new PERS retiree within 90 days of your PERS retirement effective date, you can enroll. If you lose employer-sponsored coverage, you have 30 days from the loss of that coverage. For example, if you were covered under your spouse's plan and your spouse leaves their employment and you lose that spouse employment coverage, you have 30 days from the loss of that coverage to enroll yourself and/or your spouse should you choose to. Keep in mind, you must have had 24 consecutive months of that employer-sponsored group coverage immediately preceding enrollment into the PERS Health Insurance Program. When you initially become eligible for Medicare, within 90 days of your initial Medicare eligibility into both Medicare Parts A and B, keep in mind this is typically your last enrollment opportunity to enroll in the PERS Health Insurance Program. We offer two separate non-Medicare plans. One is through Kaiser Permanente and one is through United Healthcare. They both offer a basic core value plan and they offer an HSA eligible high deductible health plan. Keep in mind if you choose the HSA high deductible health plan through either Kaiser Permanente or United Healthcare, you will not be eligible to change to the core value plan at any time. You would remain on that high deductible plan for the time that you're enrolled with the PERS health insurance program. Should you choose Kaiser Permanente, please ensure that you note your primary residence, not your mailing address, must be within Kaiser's service area, and you also must be within the United States in order to enroll in any of our health plans. United Healthcare is a nationwide plan through PERS Health Insurance. We offer 4 Medicare plans. Moda Health is a Moda supplement plan, Kaiser Permanente, United Healthcare, and Providence Medicare Advantage plans. Moda Health and United Healthcare are both our nationwide plans offered through the PERS Health Insurance Program for Medicare members. Dental plans offered by the PERS Health Insurance Program are Kaiser Permanente and Delta Dental. You can only enroll in a PERS Health Insurance Program dental plan if you are also enrolled in a PERS Health Insurance medical plan. We currently do not offer any standalone dental benefits. If one member of your family wants to elect dental coverage through the PERS Health Insurance Program, keep in mind the entire family must also take the dental benefits. You can enroll in either the Kaiser Permanente dental plan or the Delta dental plan regardless of the medical plan selection that you choose. For example, if you chose a United Healthcare medical plan and you wanted Delta dental, you could do so. Or you could take United Healthcare medical and or Kaiser Permanente. They don't have to be the same medical and dental carrier. So beyond the basic benefits, enhanced Medicare Part D prescription drug plans are included in all of our Medicare plans. As you can see on the slide below, there is no deductible. Tier 1 is an $8 copay on average, Tier 2 is $15, and so on. We offer an extra hearing benefit that was added to all of our Medicare plans in January of 2020. All of our plans include an enhanced vision benefit. Pharmacy coverage, free gym memberships are also included with our Medicare plans, expanded travel benefits, and we have nationwide Medicare plan options as well. The PERS Health Insurance Plan offers 2 separate subsidies, as we mentioned previously. The first one I'm going to discuss is our RIA subsidy, which is the Retirement Health Insurance Account. This is available to eligible Tier 1 or Tier 2 PERS retirees who choose to enroll in a PERS Health Insurance Plan sponsored Medicare health benefit. This is eligible for Medicare only. You must have 8 or more years of service, and this would entitle you to a $60 discount per month. If your spouse happens to also be a PERS retiree, there's nothing extra you need to do other than check the box on your PERS health insurance enrollment form that your spouse is also a PERS retiree, and we will automatically verify if your spouse is eligible for that subsidy. The next subsidy I'm going to talk about is what's called the RIPA subsidy, the Retiree Health Insurance Premium Account. This is also only available to eligible Tier 1 or Tier 2 PERS retirees, and you must be enrolled in a PERS health insurance program sponsored non-Medicare health plan. This has a little bit different rules as far as being eligible. Non-Medicare retirees only. You must have 8 or more years of state service. You must have retired from a state of Oregon agency. Unfortunately, municipalities and counties do not qualify for this subsidy. Subsidy is dependent on your state service time, and it's based on the tier schedule off to the right of the tab. Your PERS retirement date must be first of the month following your last date of state employment. And again, if your PERS spouse is also a PERS retiree, there's nothing extra you need to do other than check the box on your PERS health insurance enrollment form, and we will automatically verify if your spouse is also eligible for this subsidy. We have immense amounts of flexibility within our plan. We offer an annual plan change period, which gives every PERS health insurance member the ability to change plans under the PERS health insurance umbrella. You can easily move from a Medicare supplement plan to a Medicare Advantage plan. You can submit your plan change enrollment forms between October 1st through November 15th, and any changes that you elect to make would become effective January 1st of the following year. Keep in mind, this is not a time to add a dental benefit and or dependents. So if you chose to not enroll in dental at your initial enrollment opportunity, you would not be able to add dental at this time. You would have to have experienced a new qualifying event in order to add dental. If you are permanently moving outside of your current plan service area, we offer 2 nationwide plans you could change from, and you are able to switch to a new PERS health insurance plan within your service area. Should you be temporarily going outside of your current existing plan service area for 60 days or more, review your health plan's travel benefit, or you could opt to elect in one of our snowbird options. Meaning, if you were enrolled in, say, the PERS Health Insurance Providence Plan and you decided you wanted to go to Florida for 6-8 months, you could then submit an enrollment change form to the PERS Health Insurance Plan, selecting one of our nationwide carriers. And when you return to Oregon after you're done enjoying the sun, then you could go back to your existing current Providence Health Plan. Now, let's talk about some Medicare basics. You will automatically become eligible for Medicare at age 65, whether you are working or retired. Parts A and B of Medicare are called Original Medicare, and those are administered by the federal government. Medicare Parts C and D are individual plans purchased through private insurance companies or under a group, such as the PERS Health Insurance Program, to supplement your original Medicare. A Medigap plan is an individual plan purchased through a private insurance company to fill the gap of original Medicare. Medigap plans do not include your Part D prescription drug plan, which is required. Medicare is administered by the Centers for Medicare and Medicaid, CMS. Medicare is health insurance for people who are age 65 or older. If you are under 65 but you have been receiving a Social Security disability insurance benefit for more than 24 months, or if you have end-stage renal disease or ALS. You automatically become eligible for Medicare at age 65, regardless of whether you're taking Social Security benefits at that time. Enrollment in Medicare Parts A and B. First off, if you're collecting Social Security, you're automatically enrolled on the first of the month of your 65th birthday, unless your birthday happens to fall on the first day of the month, and then you are automatically enrolled the month prior to your 65th birthday. You are also automatically enrolled on the first day of the 25th month after you start receiving a Social Security disability insurance benefit. If you're not collecting Social Security, keep in mind your enrollment in Medicare is not automatic. You must contact the Social Security office to apply. We recommend that most people apply 90 days in advance of their Medicare eligibility with the Social Security Department in order to ensure you have no gaps in coverage between aging into your Medicare plan and your retirement. Should you choose to work past your 65th birthday and you're going to delay your Medicare Part B, if you work after and you keep employer-sponsored coverage through your employer, or if you are covered under a spouse who is actively working and has employer-sponsored coverage through their employer, you may be able to delay your Medicare Part B until that employer-sponsored coverage ends. Keep in mind, if you don't enroll in Medicare Part B when you are first eligible or during a special enrollment period, you may have to pay a Part B late enrollment penalty later. Please visit Medicare.org for more information regarding a late enrollment penalty should you delay your Part B. If you have some time before retirement, we would like to suggest that you keep these 4 basic steps in mind as you get closer to retirement. Start planning now for any and all of your health insurance costs in retirement. Learn about health insurance options prior to starting on your path to retirement. You can attend a PERS Health Insurance new enrollment presentation, whether that be in person or via one of our webinars. You do not need to register for a PERS Health Insurance in-person meeting. However, you would need to register for one of the webinars. You can access that presentation schedules on the PERS Health Insurance website, and that is located at pershealth.com. Know when to enroll into your Medicare plan. Make sure you coordinate any loss of active group coverage ending and your PHIP enrollment type. If you're not enrolling yet, stay informed on all PERS Health Insurance plan offerings. And again, you can find those located on the PERS Health Insurance website at pershealth.com. You can find links to our presentations, pre-recorded videos, all of our benefit guides and materials, as well as stay informed on upcoming news and events. Complete and submit your PERS Health Insurance enrollment request form within your enrollment opportunity. To learn more about PERS Health Insurance eligibility and enrollment opportunities, contact us or visit our website. We have a dedicated customer service team that is local here in Oregon. The 800 number is on the screen. Or again, you can go to pershealth.com. You can review all of our member handbooks. You can watch new enrollment presentations or register for a webinar. You can read benefit summaries and outlines, and you can also view our premium rates for the current plan year. Here are a few FAQs that we can go through. My spouse will be eligible for Medicare before me and will no longer be able to stay on my retiree plan. Can my spouse enroll in the PERS Health Insurance plan while I stay on my retiree plan? Yes, your spouse can enroll in the PERS Health Insurance plan at their initial Medicare eligibility while you stay on your retiree plan. The reverse is also true if you, as the PERS retiree, are Medicare eligible before your spouse. Your spouse would stay on the existing early retiree plan while you enroll under a Medicare plan with the PERS Health Insurance program. When your spouse then becomes eligible for Medicare, they could enroll in the PERS Health Insurance plan as a dependent under your PHIP plan. Both my spouse and I are PERS retirees, and I have 8 or more years of qualifying service. Do we have to enroll separately to take advantage of either the RIA and or RIPA subsidy that PERS contributes towards my monthly insurance premium? Again, as stated previously, no, you do not have to enroll separately. You can enroll on the same PERS Health Insurance enrollment request form. Just make sure that you mark the box that indicates your spouse is also a PERS retiree, and the PERS Health Insurance plan will automatically review both of your accounts to see if you qualify for a premium subsidy. How do I know if I belong to Tier 1 or Tier 2 or the Oregon Public Service Retirement Plan, otherwise known as OPSRP, to determine if I'm eligible for a subsidy? Your membership type, Tier 1, Tier 2, or OPSRP, is determined by your hire date with your public employer. Contact the PERS Member Services Department if you are unsure of your membership type. After submitting my PERS Health Insurance enrollment form to PHIP, I discovered that my employer would cover me for an additional month. How do I change my effective date? This is something that is very common. If your effective date has not yet passed, meaning you choose to enroll September 1st, and your employer has given you coverage through the end of the month of September, and it is now August 15th, you can contact the PERS Health Insurance Plan and let them know that you have employer coverage through the end of September and you need to change your PERS Health Insurance effective date. As long as you notify the PERS Health Insurance Plan prior to the original effective date, that is not a problem, and we'll go ahead and push your effective date out. I have a pre-existing condition. Will I be able to enroll in the PERS Health Insurance Plan? Yes. PERS Health Insurance has never denied coverage due to a pre-existing health condition. In addition, the Affordable Care Act of 2010 forbids any insurance company from denying coverage due to any pre-existing health condition as of January 1st of 2014. However, keep in mind, you must still have an enrollment opportunity to enroll in the PERS Health Insurance Plan. Thank you so much, and I appreciate your time.